Today we're going to be talking about wellness. What exactly is wellness and how do you get on a path to wellness? But before we understand how we get to wellness and what exactly wellness is, we have to look at the other end of the spectrum, illness and disease, and how we can avoid and possibly prevent illness and disease, and what steps do we take to get to the point we are now in our lives to move away from illness and disease and move on to wellness. So when I say the words illness and disease, what comes to your mind? What do you think of? Many of us will think of things like cancer, diabetes, stroke, or heart disease. And for the most part, we know that finding illness and disease is relatively easy. We may get some blood work to tell us that we have high blood sugar and diabetes. We may get an MRI or a CT scan to see what's going on with our organs or our brain or spinal cord to let us know there may be cancer present, there may be some heart issues. So illness and disease is relatively easy and people could kind of comprehend the process of finding an illness and disease and what that means. So now let's talk a little bit about health and wellness. What exactly is health? What does that mean to you? If I asked you to rate your health on a scale of 0 to 10, 10 being perfect health, 0 being horrible health, what would you rate yourself? Take a minute and think about that number because we're going to come back to that number as we get into the presentation. So do you think you are healthy and well? And how do you know this? Is health and wellness the absence of disease? So I don't have a stomach bug, I don't have a fever, I don't have any pain, nothing showed up on the MRI. I must be well. So is it the absence of disease or absence of diagnosis? Having no symptoms? Does that mean, is that what wellness is? So what is health exactly? Well, according to the Webster's Dictionary, health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmary. So just because you're not sick, or just because you don't have major symptoms, a stomach bug, a fever, a diagnosis like diabetes, stroke, or heart disease, doesn't mean you're necessarily healthy. Because as we said here with the definition, we need the complete package to enjoy optimal health and prevent these diseases. We need physical, mental, and social well-being. So unlike disease and illness, which is relatively easy to describe and quantify, wellness and health is not as easy to define. And we kind of live in a culture and society of sick and illness care. For example, we go to the doctor when we're not feeling well. The doctor prescribes medicine or makes recommendations to take away the symptoms, and then that's kind of where the care stops. Or maybe some doctors will make other recommendations or suggestions, but it's not as heavily sought after as medications or surgery. And that's reinforced by the insurance industry also, because most insurances, at least on the chiropractic end, do not pay for wellness care or wellness visits if you're just feeling a little tense, but there's no real pain and there's no restriction in your function or your activities. They will not pay for that. And even the wellness visits that they pay for the doctor, it's not necessarily making sure you are truly healthy. It's just the wellness visits are screening for evidence of illness, disease, or pathology. So taking all this into account, our culture, our society, we are left with thinking that health then must be the absence of disease or absence of illness or absence of symptoms. But again, as we just saw, that's not the definition of health. So let's take a moment and look at this graphic. This is the illness wellness continuum, and this was actually designed by a medical doctor. So think back to the number that you gave yourself on a scale of 0 to 10. And then let's compare where you're at here or where you think you are on this scale. So all the way to the left we have death, which is 0. And all the way to the right on the number 10 we have a high level of wellness. So actually on this scale the number 5 is neutral. There's no symptoms, But we also look and see we're not really paying attention to nutrition or other lifestyle recommendations such as exercise or sleep or stress management. And because we don't necessarily have the knowledge, or some people, they don't really have the interest to go much further than that, because they're fine living at a 5, because as long as there's no symptoms, everything's okay. But if we start to move further left, the more that we're not exercising, we're not eating properly, the more stressed we get, the older we get, we gradually start to lose our health. And as we start to shift to the left, if you look up top there, that's when disease starts to develop. And then now, over time, as we have maintained this lifestyle or neglect of our health, symptoms start to arise. So now we went from a 4 or 5 into the 3, 2, 1 realm. And again, that is when we're starting to get into poor health. So poor health was just next door. And now we have symptoms, so we go to the doctor and we look for resolution of those symptoms. We may get surgery, but we're starting to lose function. Our heart's not working as well. We're not exercising, so our joints are getting achy, our muscles are not as healthy, our tissues are not as healthy, we can't sit or stand too long. We went to the doctor, we got the medication, the symptoms went away. So now we shift back into the 4 or 5 realm because the symptoms are under control, and now we think we have our health back. We still have lost some function, again, because we're not active, we're still stressed, we're not eating properly. And then the medication that we have, it's only going to be a matter of time, if nothing else changes, before those symptoms recur and the medicines have to be altered, the dosages have to be raised, or we have to get different medications, or we need a different surgery. And then hopefully, again, that brings back to neutral. But sometimes that's not enough, and we progress further to the left. Now we're a 1 or less than a 1, and our quality of life has continued to diminish. Our function gets limited and limited. We need a walker. We can't stand. We have trouble bending. We're kind of just existing. We live on multiple medications. We're still hurting, and we still have symptoms that may or may not be controlled. And sometimes we can't even get back to a 5. The further left that we have shifted, the more complex we have become. So when we're in this continuum from moving from neutral to the left, the doctor's doing a lot of work. He's ordering a lot of tests. He's ordering a lot of medication, and you become just kind of a passive recipient of the doctor's care. So if we move from neutral to the right, we can see that we are exercising regularly. We kind of understand what encompasses a healthy and well lifestyle. We have a wellness foundation and education. We're eating good. We're trying to manage our stress. We're sleeping properly. So now we're taking steps in addition to not feeling symptoms. We're moving further to the right. Now we're anywhere between a 7, 8, and 9. And now we have a big buffer in front of us before we even get back to neutral. And this buffer is what I want to talk about. Now, as we get older, we may never get back to a 10 like we had when we were younger and in perfect health and nothing was wrong no matter what we did. But the goal is not to be perfect. The goal is to create this buffer so as we age, and we will age obviously, we all aren't going to get off this earth alive. So what we want to do is have this buffer so as we start to age, as our health starts to decline a little bit, and as symptoms start to pop up, we, instead of living at neutral and then going right into a 3 or a 2, we have lived at a 7 or 8, and then as our health starts to decline, now maybe when we're 70 or 80, we're back to baseline. Instead of living at a 5, kind of a neutral, and then as we start to age, when we're 40 or 50, we start to go to the left, we don't have that buffer and we go right into the poor health and disease category. So the whole goal about wellness is not only living your optimal life, your physically optimal life, socially and mentally optimal life. You want to create that buffer so you're not suffering as you are living in on this earth. So hopefully now you can see that wellness is much more than the absence of disease. It's living as close to 100% capacity, being as far on the right of that illness wellness scale as humanly possible. It's having the physical, mental, and emotional endurance to live and get through the day. It's waking up, looking forward to the day with passion and vitality, not making it through the day, making the day. And if we understand what wellness is and we know the simple steps we can take to engage in a healthy and well lifestyle, we will be living as close to 100% capacity as possible. And that is our ultimate goal for all of our patients. And that is what we would want to at least educate our patients about what is possible and the other end of the illness wellness spectrum. So ultimately, our health, our well being, our wellness is up to us. It does take a lot of work to stay to the right of neutral. You will have to put in a lot of time and energy. But it's like the old saying goes, you put the time and energy in now or the time and energy in later, in being sick, in paying for medications, um, maybe being in the hospital. You pay with your time now or later, but at least paying now, you're investing in yourself, you're investing in your health. Because staying to the left of neutral or as disease develops and illness develops, there is a price for that as well. So, like I said, we want to create that buffer. We will have ups and downs, period of ill health, no matter how healthy or in wellness of a wellness lifestyle we're in. But hopefully, when we do have dips and blips in our health, we can recover and bounce back sooner because our body is functioning as optimally as it can, and it could fight off whatever illness it is to get us right back. And our goal is to get back to 7, 8, or 9 and stay there for as long as we can, to age as gracefully as we can, as comfortably as we can be. But again, it's all up to us. So the question always is, what about my genes? Not those genes. So our genes, our genetics do have a role. It's the old adage or the old question, are what we are accumulation of nature, what we're born with? Are we destined to be the way we are? Or is it nurture, our lifestyle, our environment, our choices? And it's probably a combination of both, and that debate will always be going on. But paying attention to your lifestyle and focusing on things you can control is what's important, because we know we can't change our genetics, but we could possibly change the life that we're destined for with our choices. So just because your mother or father had chronic back pain or disc degeneration or high blood pressure or stroke or heart attack doesn't necessarily mean that you have to or you will. So when we look at genetics versus lifestyle, we kind of tell patients, because what we're realizing is genetics is kind of the kindling. So it's kind of setting the foundation for a fire, but it doesn't mean that the fire is actually going to be caused in a raging fire. The fire needs a spark and it needs oxygen in order to expand. And what we know is, while we may have the kindling of illness and disease, our lifestyle is what provides that spark to make a fire. And the further left from neutral that we shift on the illness and wellness continuum, that chart that we just spoke about, the bigger the spark and the bigger the flame, and the more likely your life is to be out of control with illness and disease and hard to manage. So let's look at chronic illnesses and diseases in America and then kind of trace back what the risk factors for those diseases are. So 1 in 2 adults in the US have a chronic disease, and 1 in 4 have 2 or more diseases. Now these are the leading causes of death and disability from these chronic diseases. What are they? Heart disease, stroke, cancer, lung disease, Alzheimer's, type 2 diabetes. All things that we're familiar with, all things that we have relatives that have family members that have friends that have. But if we trace back to the underlying risk factors, most of the time genetics plays a smaller role than if we look at what's listed here as the whole person, the web of chronic disease. Tobacco use, we can control that. Our alcohol use, we can control that. Our cholesterol and blood pressure, we can control most of the time through diet. Physical inactivity and obesity, that's also under our control. In fact, when patients adopt a more healthy lifestyle with exercise and nutrition, they can actually naturally lower their blood pressure, cholesterol, and get rid of diabetes. So you don't have to take medicine. And if you can get rid of these things naturally with lifestyle choices, then what does that really say about the argument where our genetics are our sole determinant and destiny? So we have to look at ourselves, our current state of being, our current state of illness, or our current state of wellness, and ask ourselves what lies beneath the surface. Because our symptoms, the way we feel, is what we express on the outside, especially when we go to a doctor. But what makes up our iceberg? What lies beneath the surface? What makes up your iceberg? Those are the questions that we need to answer and explore. Because what lies within the iceberg will tell us whether you're on a path to illness or wellness. Beneath the iceberg, what is your underlying level of nutrition? Are you eating a diet rich in fruits and vegetables and healthy fats, or are you eating an inflammatory diet? That's one component. Are you exercising? Are you meeting the minimum weekly requirements for exercise? Are you sleeping properly? Are you managing your stress? These are major components that fight off chronic illness, disease, and even have a role in our pain perception and level of pain sensitivity. So we can answer what is going to be expressed on top of the iceberg by what makes up the iceberg within us. So we have to ask ourselves what lies in our iceberg. And that has a direct relation of where we lie on the illness and wellness continuum and a little insight to the life that awaits us. So what does your iceberg look like? Is it one that represents an iceberg of wellness or an iceberg of illness and disease, leading to possibly premature death and a life that is not 100% health and optimization? So hopefully we gave you some insight onto what a wellness lifestyle looks like and what composes a wellness lifestyle and a healthy lifestyle, and that you know it's much more than lack of symptoms. Um, we have other lectures and topics that we talk about where we address each individual component, such as exercise, stress management, nutrition, and sleep hygiene. They all are important. They all need to be balanced and implemented in order for you to be on that path towards wellness.